Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Then the next drug, Encainide. Encainide. Encainide is actually a class 1C drug. This Encainide will block the ischemic sodium channels. And these Encainides are short-acting drugs, and these will block the conduction. The main important thing in Encainides is they block the conduction. So because they will block the conduction, they are used in ectopic beats. They can be used in ectopic beats, but they are not the drug of choice for ectopic beats. But the drug of choice for ectopic beats is actually the beta blockers are the drug of choice for ectopic beats. Enkinides can be used in ectopic beats because they block the conduction. Then this enkainide is also useful in it is also used in Wolff Parkinson's White syndrome. This enkainide, this enkainide has a side effect. Actually, Encainide is maximum pro-arrhythmic. It is not just decreasing arrhythmias, it itself can cause the arrhythmias. So it is not used prophylactically. Because it is pro-arrhythmic, it is not used prophylactically. Even flecainide also has the similar features, which is flecainide. Then flecainide also has the similar features. Now, two important points of flecainide. Flecainide is drug of choice in Wolff Parkinson's White syndrome. The drug of choice is flecainide. And flecainide is also used in the diagnosis of Brugada syndrome. Also, we can use this flecainide. But one more important thing is for Wolff Parkinson's White syndrome, the drug of choice is flecainide. But Wolff Parkinson syndrome, the definitive diagnosis of Wolff Parkinson syndrome is radio frequency ablation. The definitive diagnosis of Wolff Parkinson syndrome is radiofrequency ablation of aberrant pathway.
thank you and thank you for watching.